What's going on with the internet? There we go. We are live. Hello, everyone. This is the voice and the face of Dr. Tolu Olabinto. I'm the CEO and the co-founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas, not too far from Dallas area, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. And that's why we're here today. We're having a conversation on how to improve quality of life. And our topic today is understanding heart attack, and it's a talk with an interventional cardiologist. We're working to get him on here, so hopefully he's able to join us this time. So we'll see. If you are watching live, hashtag live. If you're watching in replay, hashtag replay. If you have a friend, you have a colleague, you know somebody who's concerned about heart disease, has had a heart attack, and is concerned about reducing further risk, please, by all means, be kind. Share this, forward this, tag them in the comments so that we can have them watch and ask questions live. Now, for some of you who are wondering, you're like, well, why did you choose this topic? Well, as a primary care physician, I see patients typically before they get to that point. And the whole idea is to minimize the risk of you needing to see an interventional cardiologist for treatment of a heart attack. And so we're having this conversation because I want us to have a cardiologist's view on what it's like, when someone's having a heart attack and some of the interventions they do, and how, why it's important to do the things to prevent you from having to need to get that kind of a treatment. I'm glad that it does exist because, medicine has come a long way. And so there are a lot of modalities to treat heart attacks and to help people who have suffered decreased blood flow to their heart or reduced blood flow to their heart to survive and live longer lives. So I'm glad that medicine and this technology exists. But when a cardiologist come and tell you the things they have to do, and I think it gives a different perspective, and it helps also encourage you and nudge you in your health journey when it comes to preventing heart attacks. So our guest, information about our guest, let me see how he's doing. Hang in there. Let me see. Dr. Hussein, can you hear me? Oh, I'm not sure he can hear me. Let me see. Okay. All right. So we're still trying to get him on screen. But in the meantime, we'll keep going. Dr. Hussein is a cardiologist. He's an interventional cardiologist not too far from us here in Mansfield, Texas. Let me see. I see him. Let me see how we're doing. All right. He's an interventional cardiologist, and he's backstage. Hang on. Let me try it and see. Dr. Hussein, can you hear me?
I do hear you, but do you hear me?
I can hear you. Yay.
Okay, I'm so sorry. I just entered the house, so my kids are here. So
no
I'm so sorry. I was driving. Yeah. How's everyone?
Everyone is good, and we're so excited to have you here. Thank you for joining us.
No
I was
problem.
just talking.
Thanks for inviting me. I highly appreciate, and thanks for everyone for joining us.
We're gonna make this. This is gonna be fun.
Yeah. Let's see. Let me show you this.
Hi. Oh, she's beautiful. Hi. How are you?
Yeah. She's my 2-year-old. This is my 4-year-old.
Hi.
So, hi.
Wow. So, you have beautiful kids.
Thank you. I appreciate it.
All right, Dr. Hussein, I really appreciate you doing this, even though you're busy. I appreciate you doing this and rolling with the punches. So thank you.
I highly appreciate that you arranged this for the community. That's pretty unique, and then it's very nice of you that you take your time out and then you educate people, because prevention, I believe, is the key.
Yes, sir.
Yeah.
Yes, sir. But doctor, I was talking about you, but I want you to introduce yourself. Who are you?
Okay,
What you
yeah,
do?
yeah. You just get I'll be back.
This is going to be fun. Oh my goodness. They're cute. Do you guys agree? Oh,
My
the
name is
beautiful
Dr.
kids.
Hussein. I'm the interventional structural cardiologist. What's mean by that? It means that people who can treat all sort of heart conditions, most of them, I would
Okay.
say, through the tubes and the wires, and they go place stents, place the valves and stuff, and then definitely they also work with the in prevention that people who has any clinical risk factors such as diabetes, hypertension, high cholesterol,
Mm,
uh, who are at risk of developing any heart conditions like heart attack, blockages in the arteries of the heart, of the legs, or anything like that, then we just keep them on certain medications which can prevent them from getting those kind of situations where they get stent or they get bypass or they get like blocked arteries in the legs or they get
mm.
blocked arteries of the brain and they get stroke and stuff. So we also work for all those sort of conditions. So as far as that's what is called interventional cardiologist. And
Wow.
then yeah,
Okay.
and as far as like I got trained for 7 years, did residency, fellowship, and then did my intervention fellowship, and then I started doing the practice. So I did my med school like uh, in 2006, so it's like long
Wow.
time ago. So
Yeah.
it's like, yeah,
That's been a while. That's been a while.
yeah,
But that's wow. Thank you for what you do. Yeah, you unclog a lot of pipes when it comes to the heart, when it comes to blood vessels, when it comes to saving organs. So this is powerful. Now, Doc, my first question to you is this, or my second. What is a heart attack for someone who's watching? What is a heart attack? What does that mean?
it means that every human person uh, who born like even with the kids also over a period of time everybody develop plaque inside the arteries. So the cholesterol plaque it deposit over a period of time in the arteries, and then those plaque build up goes to the point where it started compromising the blood flow. When it start compromising the flow, then it comes to the point where the flow is so bad that either you started getting symptoms like chest pain, shortness of breath when you exert yourself, or sometimes then that narrowing is so such as that some platelets, the sticky cells of your blood,
Mm,
they go and accumulates there and they block the flow 100%, and then you get heart attack. And
mhm.
then what we do is that we go take pictures and see how bad is the narrowing. If narrowing
Okay.
is significant, then we go and place the stent and open it up. In some stances, if narrowing is multiple narrowings are there, then people need bypass, like open heart surgery, and they do the bypasses.
Okay. Now you said something very important. You said even as children, so heart attacks don't happen overnight, right? It's
Absolutely.
built up over time,
Yes.
right? And so the preventive thing is very, very important to minimize risk factors. You mentioned cholesterol, you mentioned blood pressure, you mentioned diabetes. Now, let's talk about symptoms. What are common symptoms of a heart attack? So for those who are watching, who may not be sure, and how does it differ a man versus a woman?
Very good question. So definitely the typical symptom is like we usually say the elephant sitting on the chest. It's like you
Mm,
feel like that somebody is squeezing in your chest. And that is like very typical, which I would say 50% of the population that experience that kind of symptoms. And then along with that, they feel short of breath. Sometimes they feel palpitations. Sometimes they started getting excessive sweating when they were getting this chest pain. Those are the common symptoms, but not necessarily everybody get these kind of symptoms. Especially
okay.
in females, the symptoms can be different. Like sometimes they feel jaw pain, sometimes they feel neck pain, sometimes they only feel this bilateral shoulder pain. They can feel back pain, or in diabetic patients, they don't feel anything. They
Hmm.
just feel short of breath, or they sometimes they just come to the hospital and they're like, I don't feel myself. There's something
Mm.
going on, because the diabetic patients, they have sometimes those nerve damages, and due
Yeah.
to those nerve damages, they don't feel that squeeze in the chest and stuff, and that can mask their symptoms. And then, like, sometimes there's unfortunate patients, they don't feel anything and they get major heart attack and they stay home because they are not
Mm.
feeling anything. And sometimes people are so lucky that they have low pain tolerance that they jump off of the bed and then just come to the ER. And I said, this pain was a blessing in disguise for you, that because your pain tolerance is so low and you came to the hospital and
Mm.
it saved your life.
Life.
So yeah, so
Okay. Now, if someone is having heart attack symptoms, what do you typically what are immediate steps that you recommend for them? An obvious
yes.
answer, but yeah.
Yeah, no, immediate, definitely. If you're having chest pain, then if you have availability of baby aspirin, if you or your family member or anybody has the baby aspirin, you just take 4 baby aspirin. If if for example those 4 baby aspirins is not helping you, if you already have uh, history and then doctor has prescribed you some nitroglycerin or something, you can place that nitroglycerin under the tongue, wait for
Hmm.
5 minutes and see how the chest pain behaving. If still
Okay.
chest pain is there, then just put one more tablet under your tongue and wait for 5 4 minutes. And then if still the chest pain is there, then just call 911 and go to the emergency room. um, but definitely, yeah. But like, usually I tell my patients that nitroglycerin twice. Usually they say three, but I say usually twice. I don't say 3 times. I say twice is fine. 10 minutes. Wait for 10 minutes. If still chest pain is there, don't wait more. Call 911
Mhm.
and go. Do not ever try to just drive yourself to the emergency room or something. Do not do that.
Hmm.
This is not smart. Sometimes people can pass out, they can go into a cardiac arrest or go into a crash, and something bad can happen. So just, if you're not with yourself and you're feeling so much pain, do not try to drive. Sometimes people try and they come to the ER, but it's not a wise thing to do.
Okay. Thank you for that feedback. Now let's talk about age and family history. I have clients, patients, people who are watching, potential patients who are saying, "Ooh, there's a family history, and there's a nervousness about father had a heart attack, grandfather had a heart attack, maybe a sibling had a heart attack, and they're afraid that that's something that could happen to them." Would you generally advise people in that boat?
So definitely, it's a very good question. So whenever I would say either female or male, if they have very pretty strong family history, then you just keep an eye at your blood pressure level, your cholesterol level, your diabetes, if you're not diabetic. So just make sure that you have eye on those three important things. And if you are a smoker, then try to quit smoking, because that will be like a double-edged sword, that you have
Hmm.
strong family history plus you're smoking, then it means that you're cutting from both sides then. So try to quit smoking if you're a smoker, and then just go talk to your doctor. Hey, I have a strong family history. How can I prevent? The
Hmm.
best prevention definitely is check your cholesterol level. You can do your calcium score. If you already have some deposit of the calcium in the arteries of the heart, it means that you are getting plaque buildup there. So you start doing some, like, eating healthy, avoiding red meat, avoiding pork and stuff, high greasy food, taking some cholesterol medications to not, that those plaque buildup do not go so fast that you get heart
Hmm.
attack and stuff over a period of time. So these kind of things you can do, and you need to start doing that once you cross 40. So you should be very vigilant about those things.
So you heard the doctor. I didn't say anything. He said talked about limiting certain foods. But doc, we're in Texas. That's hard. Butter is in
I
everything,
agree.
and it's larded. Um, so can we what would you say? Maybe three things, three preventative measures and lifestyle changes that can significantly reduce the risk of heart attacks. I know you already mentioned them, but I want for emphasis just three.
I would say, um, if you have any clinical risk factors, three major clinical risk factors: high cholesterol, diabetes, hypertension. Make sure that you're controlling those. These are the three. Plus, try to do some exercise, stay active. At least do half an hour exercise in a routine basis, like 4 to 5 times a week. That is very important because this is your indirect testing you're doing for yourself that you are not getting any problems. That when your heart rate goes up, for example, you have significant narrowing, then you're going to start getting symptoms. And if you are not, if for example, somebody who's running 2 or 3 miles a day and stuff, then they know that my heart rate goes up to 140, 150, and then I don't feel anything. I feel completely fine. It means that they don't have any critical blockages. So eating healthy, keeping an eye at your risk factors, smoking, trying to quit smoking, and exercising. These are the things that if we do, then I say that you're going to stay away from us.
Yeah, there you go. Now, he's a good doctor, but we don't want you to have to go see him because that too often, because that's not a good thing, right? But I'm glad that you do what you do. Now, doc, for someone who's had a heart attack, who's like, yes, I had a stent, for someone who's even said I had open heart surgery, does it mean they have a new heart? Does it
No.
mean they have a stronger heart? And I'm asking this question so that I guess to encourage people to not get to that point, one, and then two, to encourage those who've gone through this to know that there's still work to do. But what would you say to that, sir?
Absolutely. I usually tell to patients when I replace the stent or they get the bypass surgery, I said half of the work doctor has done, half of the work you have to do. And it means that you take your medications religiously. If you have any bad habits, quit those and you change your lifestyle. If you're not gonna, I said, if you're not gonna do your part, believe me, things not gonna work. Whatever
Mm,
we do, you're gonna be here. If people are keep smoking and they keep getting bypasses or keep getting stents, things not gonna work. You things not gonna work. You're gonna be here with us. We're gonna be keep doing what we're doing, and then eventually things gonna go out of hand, and then we cannot do anything. So definitely, it's like half part we gonna do, half part you gonna do. That's very important, and especially if somebody who get heart attack came in with the acute heart attack and replaced the stent, I said, this is a new life. This is a wake up call. Please change your lifestyle. If you're not gonna change, definitely things can be. Today you are lucky. Tomorrow maybe you're not.
mm, mm. All right. So, final question before we wrap up. I have someone who's watching, Doc, who's saying, "Man, I know there's a strong family history, and but I'm young. I'm in my 40s. Why don't you relax a little?" Or they're saying, "You know what? I'm scared. I'm afraid, and I don't know. I don't want to have a heart attack, but sometimes some of the things they're asking me to do is hard or inconvenient." How could you encourage them, sir, when it comes to their heart? How could you encourage our viewers when it comes to their heart?
Encourage about the lifestyle.
More like, it's almost like a challenge to people who are watching, like taking care of your heart. Why should we take care of our heart? It's inconvenient, doc. I like to eat the greasy stuff. I like to go out in Texas and eat steak, you know.
I know means like if you don't have any risk factors and you're pretty active, I'm not saying that you cannot consume red meat or pork and stuff. You can. I'm not stopping you. But the thing is that, but the thing is that if you're eating red meat on a daily basis, no, definitely you're not doing a good thing for yourself. Eventually, that grease need to go somewhere, and then
Hmm.
it's gonna go somewhere in deposit. So bottom line is that the best policy or best thing is that everything should be in moderation. So if you're
Moderation.
doing everything in moderation, then that's good. If, for example, you're doing something excessive, you're eating too much spices, that's not good too. If you're eating too much sugar, that's not good too. If you're
Mm.
eating too much grease, that is not good. So I mean, if you keep and like just make a part that of your food that um, eat vegetables, eat more fruits also. Just make a habit of eating those. And then I usually say that when car is sitting in the garage, it not need it, it that need you don't need to fill up the tank.
Right.
because when it's running, you need fuel. So when
Right.
you are running in the whole day, then you need to eat. When you're going to bed, you don't need to eat. You just eat minimal and then just go to bed. Because
I like
otherwise,
that.
if you're gonna eat this much and you go to bed, then you fill the tank. Then what's gonna happen to that fuel? Your body, your system gonna process it and it's gonna deposit as a fat.
Right.
So
Mm.
everywhere because you're not doing anything right now. So if in the daytime you're working and stuff, you're
Hmm.
eating, then you're utilizing those calories. So yeah, so means like yeah, that's the thing. But yeah, you can use red meat. Absolutely, you can. If you don't have any preconditions, and if you didn't have any heart attack or stent or bypass, then you can use it. But definitely use in moderation. Don't eat steak daily.
You heard the doctor. Careful with steak, and moderation is key. He did highlight more fresh fruits and vegetables. So there you have it. All right, doc. Where can people find you? They're like, oh, I like this doctor. I want to refer my patients to him, or they want to connect with you, doc. Where can people find you?
So, as far as our clinic address, so we are at Regency in Mansfield, Regency Parkway, and as far as the hospital where I work in Methodist Mansfield, I work in Methodist Charlton, and then definitely you can Google it. It's called Precision Cardiac and Vascular Care. I can show my card also here if you can see here. This is my card, and then
Precision cardiovascular care.
yeah, Precision Cardiac and Vascular Care. As far as the address in Mansfield is 221 Regency Parkway, Suite 105, Mansfield, Texas. And as far as the number of the clinic is concerned, so I can tell the number also, 214-884-7525. So you guys can call, make an appointment if you have anything to discuss, any heart condition, any concerns, anything, you can come and talk to us. We will try to help you out.
Awesome. Awesome. Thank you so much for taking the time out from your
No,
kids, from
no,
your busy schedule to do this. We're going to do this again in the new year, but I'll give you a heads up. Okay.
thank you, ma'am. I highly appreciate what you're doing. I highly
Thank you.
appreciate and happy New Year, everyone. Happy holidays.
Thank you. Thank you so
Thank
much,
you,
sir.
thank you.
Bye. All right, there we have it. A lot of things you've learned, a lot of things we've been encouraged to do. You are worth the inconvenience needed to keep your heart functioning in a way that best serves you, so you don't need to go steamed, anytime soon. But please, as always, share this, tag your friends, tag your family, encourage those who may have had heart conditions or who are concerned about it with this video. And as always, if you or anyone you know is looking for a thorough, a compassionate, and a patient family medicine family physician in the Mansfield, Dallas area, I am she. Have a good one, everyone, and I'll see you next time.